I'm Rohit, and I recently graduated from ACU last year, and I'm now a first year grad, currently working in trauma and neurosurgery. So I am going to talk to you guys a little bit about how I use evidence-based practice to inform my treatment with patients, especially during my placement year last year. So the first case I'll quickly talk about is actually a patient who had ovarian cancer. To start off, she'd gone through a lot of chemotherapy for this. She was probably in her 60s, and the chemotherapy resulted in a lot of fatigue for her. Because of the fatigue, her quality of life diminished quite significantly, and she was just in a really, really bad place. And the reason why I was seeing her on my placement was she had gone for a hysterectomy, so getting rid of her ovaries that were affected by cancer. So when I first saw her, she was really reluctant to exercise. She was really reluctant to mobilize. She just thought, I've had chemotherapy in the past, didn't really work that well, and now I'm super fatigued. So I thought, how am I going to instill some hope, and how am I going to get this patient to participate with exercise? One thing that I use to make sure that I'm doing the right thing with patients is looking through the literature and looking through evidence-based practice. So I started Googling, started going through a lot of databases to try to find what I could do for this patient. So I found this really good study that looked at the benefits of exercise, and I had a really good read through it, and I saw that, wow, like exercise with cancer patients can reduce weight gain, reduce cognitive dysfunction, lymphedema, arthralgias, so like pain in your joints, nausea, psychological distress, fatigue. It decreases the risk of cancer relapse, and it decreases the risk of secondary cancers as well, and also improves your pulmonary function. So I thought, wow, if exercising and meeting these guidelines for exercise, if you can meet or start to meet those targets, you can have these enormous effects on your symptoms. So I went through the evidence. I found that this evidence is really strong, and I used my skills from university to critically appraise that evidence to make sure it was good, strong evidence. And then I relayed that to the patient, and I showed her how much this affected patients that went through what she went through. And she was so astounded by how much of a difference it made. And I reassured her that she didn't have to get 150 minutes to begin with. You know, it's baby steps. She was still in the hospital. But I got her on a walking program. I referred her to outpatient exercise physiology, and she was so happy with it. And she reignited her flair to have some power and control over what she had been through. So that was really cool. And I think evidence-based practice was at the crux of that, because it really proved to her that she could have control over cancer.
This campaign is supported by World Physiotherapy and physiotherapy organisations in Australia, Italy, France and the Netherlands. Please join us in the PEDro Tackles Barriers to Evidence-Based Physiotherapy campaign and help tackle the biggest barriers to evidence-based physiotherapy. You can follow the campaign on the PEDro webpage, blog or social media.